Hello everyone, my name is Valerie and today I will be doing a presentation on hypothyroidism. Hypothyroidism is a significant and common endocrine disorder that results from a decreased thyroid hormone production or a defect in the machinery of receptor activity, which is associated with the thyroid hormone. It can be acquired or congenital, where it manifests at birth, or with a delay due to different congenital defects. There are two kinds: clinical, which is also known as overt, in which the TSH is increased and the T4 levels are low, or subclinical, which the T4 levels are normal but the serum TSH level is elevated. So the pathophysiology behind this is the thyroid gland is regulated by the pituitary gland. 100% of the levothyroxine, which is T4, in the blood is produced by the thyroid, while only approximately 15% of liothyronine, or T3, is released from the thyroid. Most of the T3 in the blood is due to T4 to T3 conversion in the peripheral organs such as the muscle, liver, and kidney. When the thyroid hormone levels are low, the pituitary releases TSH to increase the thyroidal production and release of thyroid hormone. The relationship of TSH to free T4 is a negative log linear relationship. As a result, small changes in serum T4 are associated with large changes in serum TSH, and it is for this reason that we see the TSH levels are more sensitive than direct thyroid hormone measurements, and the TSH levels are elevated. Hypothyroidism is classified according to where it's happening in the thyroid gland, either as primary or secondary. In primary, the thyroid gland is defective, but with secondary, there is a defect in the functions of the posterior pituitary gland, which is responsible for the secretion of the thyroid stimulating hormone, or TSH, and it alters the function of the thyroid. Some of the risk factors include age, sex, geographical factors. It is more common with older females as they're 10 times more likely than males to get it. Other factors are associated with hypothyroidism are high LDL levels, triglycerides, total cholesterol, obesity, high blood pressure, and metabolic syndrome. Some of the major signs and symptoms that we see are fatigue, cold intolerance, dry skin, constipation, weight gain, vocal changes, muscle aches, cirrhosis, decreased sweating, thickening of the skin, brittle hair or hair loss, oligo or menorrhagia or oligomenorrhea, and some of the signs we see with subclinical hypothyroidism is depressive symptoms as well. Testing for hypothyroidism is on numerous factors, which include lab tests, existing symptoms, family history of thyroid dysfunction, the presence of a goiter, or an ultrasound evidence of thyroid autoimmunity, also the presence of any circulating anti-thyroid antibodies such as anti-TPO or anti-TG or TSH receptors. Depending on what kind of hypothyroidism, if it's clinical, the labs will indicate a high TSH level and a low T4 level. If it's subclinical, then it will have a high TSH and a normal T4 level. So this slide here, we can visualize and see the common symptoms that we see with hypothyroidism. So we start off with the changes in the brain. It can cause any fatigue, memory impairment, or depression. On the facial features, people will present with swollen face, swelling of the eye socket, rough or deep or hoarse voice. They can have weight gain or suffer from constipation. As mentioned previously, they can have dry, rough skin or thickening of the skin, paresthesia, or muscle cramps. Their hair, they can have hair loss or just thin, brittle hair. They can have an enlarged thyroid gland visualized as a goiter. Their heart rate is slower and weaker. And then for males or females, they'll have low sexual drive, diminished potency, infertility, and cycle disorders. These are my references, and I hope you guys enjoy my presentation. Thank you.